Right now, somewhere, someone is pinching their nose and clamping their mouth shut to stop a sneeze from happening in public. Most people do this without a second thought. In rare cases, it has sent people to the hospital. A sneeze isn't a gentle exhale. It's an explosive release of air that can exit your nose and mouth at speeds reported up to 100 miles an hour, built up by pressure your lungs and chest muscles generate specifically to expel irritants. When you block both exits at once, that pressure has nowhere to go, except backward into the softer tissues of your throat and sinuses. In 2018, doctors in the UK published a case report of a 34-year-old man who did exactly this, felt a popping sensation and searing pain in his neck, and could barely swallow or speak. A scan showed he'd ruptured his pharynx, the muscular tube at the back of the throat, from the trapped pressure of his own blocked sneeze. He needed a week in the hospital and a feeding tube to recover. This is not a common outcome. The vast majority of blocked sneezes cause nothing worse than an uncomfortable pressure headache. But doctors have also documented ruptured eardrums, damaged blood vessels in the eyes, and in isolated cases, air forced into the chest cavity, all from the same reflex most people think is harmless to interrupt. The mechanism is simple. Your body built the sneeze as a one-way wide-open valve for a reason. Closing both ends turns a release mechanism into a pressure vessel with nowhere for that force to escape except through the weakest tissue. So next time you feel a sneeze coming on somewhere inconvenient, the actual medical advice is almost anticlimactic. Let it out.